My name's Hannah Harwood. I'm an orthoptist and I work for Lancashire Teaching Hospitals. Orthoptists work within ophthalmology, and at its core we deal with defects of your eye movement systems. We see a lot of adult patients who have various neurological problems that can manifest itself as a defect of eye movement, or it might be that you have a misalignment of your eyes from childhood that you're keen on having corrected. So we would detect and categorise and measure that and support the management of it. Now, as with many health professionals, orthoptics has developed and expanded over the years, so there's a scope to actually expand into other areas of ophthalmology as well. Currently within our team we have specialist orthoptists working in the area of stroke, because as a result of stroke you can have a lot of visual symptoms, so they work with the stroke team to detect and manage those. We also have specialists working in the area of glaucoma, of visual processing difficulties. We have an orthoptist who goes out and looks at the children on the ward who are born very early and prematurely, to have a little look at the structures of their eye, because you can have problems if you're born prematurely. I have developed my skills in the education side to help support in the teaching and learning of future orthoptists, and we also have a specialist who works within the area of low vision, so people who have had an eye condition that has left them with permanent reduction of vision. They will assess them to give them aids and as much help as we can to make the most out of the vision that they have left. I heard about orthoptics completely by chance, and I would say by luck really. I wanted to go to university. I was doing A-levels in science and I wanted to work in some kind of health profession, but I didn't quite know what I wanted. I knew I didn't want to be a doctor and I didn't want to be a nurse, but it was completely by chance that I came across the degree course for orthoptics. So I really do love my job and I am quite passionate about my job. I've been qualified for 10 years and I've really pretty much loved every day. What I like most is that every day is different. That I get a nice mix of patients, because I get to do those paediatric clinics as well as adult clinics. Every patient is an individual, so even if you're treating people with very similar or the same kind of conditions, you're always tailoring things to that individual, so that makes every day different as well. I also like the fact that there's a lot of opportunities to expand your skill set as well within ophthalmology. I've actually seen the career itself change a little bit over the 10 years in terms of the opportunities for you to go on to do further learning and to expand into different areas. This year 2020 has been a little bit challenging because we had to scale back some of our services temporarily, and that was difficult because we had to find ways to provide care through different methods, but in some ways it was quite exciting because it kind of accelerated plans that were already in place to develop kind of tele and video medicine as well. So the advice that I would give to anyone thinking about a career in orthoptics would be to research exactly what orthoptists do, because this is more than a job. It really is a vocation, and you need to know that it's definitely the thing you want to do, not least because you have to commit 3 years of your life to do the degree course to train in orthoptics. It's very important that you know that this is definitely the outcome that you want.